Death as a product of opioid consumption is skyrocketing at an alarming rate. If you simply walk along the streets of a major city like Philadelphia, you can witness this firsthand. Addicts and drug users are spread across the entire town. Compared to the previous 5 years, deaths have more than doubled. But it's not just the death rates that are gaining traction. The nature of the drugs in which are undergoing consumption is also substantially changing. Heroin was once the prime culprit before fentanyl, an even more powerful opioid, killed even more users. Now, nitazines and tranq are plaguing the streets, with such tiny quantities killing a user. Here are the respective quantities. Thankfully, with modern medicine, we can actually treat most things, including addiction. Here's the problem though. Our treatment as of yet is honestly far from good, and the results are kind of agreeing with this. Whilst the primary form of treatment does have some positives, there are many negatives. Here is why it's increasingly harder for addicts to stop their usage, plaguing them to addiction forever. This is methadone. It's commonly prescribed to those with an opioid addiction in order to get them off of illegal substances such as heroin and fentanyl. You see, methadone, or its brand names doliphenophyseptone, is actually an opioid itself. It's got a very similar composition to that of heroin, and too has been used before as an opiate-based pain reliever. The main difference is that methadone is used in the concept of harm reduction. This is basically intentional practice to lessen social and/or physical consequences of things like drugs. If we give someone in-treatment methadone instead of heroin, since it's prescribed, we know that the methadone isn't going to be full of toxins and safer than what's found on the street. In regard to how it works, it's no different than your other opioids. When they're consumed, they'll eventually end up in your brain. More powerful ones will cross the blood-brain barrier at a quicker pace and cause a much greater high. Even though it's a treatment, methadone does this too. It'll bind to the same receptors just as typical opioids. It's an agonist and causes the pleasurable feelings of the high. However, it's different in the sense that methadone works in a more gradual manner. It's more controlled, lasts for longer, and again is prescribed, making it much safer and therefore cheaper in most countries, albeit the US, than standard illicit heroin than one would find on the street. By lasting for a longer duration, it's also believed to reduce the craving in addicts for the substances, meaning that they won't want to go and buy some. Typically, prescriptions or scripts will see them collected at a pharmacy, most commonly daily, and will be taken then, lasting for the majority of the day. Eventually, those addicted to opioids will have the millimeters gradually reduced. They might start on 60 milliliters daily, and then slowly reduce down by perhaps 2 milliliters every month, until they're eventually successfully off opioids and have completed their treatment. Now, it would be unfair to completely bash methadone, for methadone has been able to stabilise many lives of those who do undergo its treatment plan. Plus, around 85% of those who do undertake it reduce their criminal activity. They're not breaking the law to source the heroin. There's also some interesting research that found those on the treatment are in fact more likely to beat their addiction than just trying to do it themselves. But most of all, methadone has significantly reduced the rates of blood-borne viruses. Due to users no longer needing to inject, transmission of hepatitis and HIV has drastically reduced. Yet, it's still far from perfect. Yes, methadone has been amazing in reducing opioid-related deaths, halving the number. But in a study from the University of Harvard, only 25% of those on a methadone treatment plan enter abstinence, meaning that not only are 75% of users never leaving treatment and/or continuing use, 50% of the user population is still subject to death. So clearly methadone has its flaws in statistics, but what if I told you about some of the greater risks of the medication? One of the leading problems with methadone is due to its tolerance. With prolonged opioid use, the brain will eventually have reduced response levels upon the consumption of opioid-based drugs. The brain, being so adaptable, will have its neurons desensitized upon repeated consumption of methadone. This can then cause downregulation. Fewer neurons being available on the cell surface which respond to opioids, or the ones that do remain may just become less sensitive. This means that when methadone is regularly consumed, keep in mind it's often every day, the receptors will gradually become weaker. Instead of the user reducing their dose, it will be increasingly hard to hold them. They'll either have to increase their script or use street heroin alongside, obviously two unfavourable options. But why will the user have to increase? The answer is withdrawal symptoms. Withdrawal symptoms for any drug are so much more powerful than the average person realises. For example, if an alcoholic suddenly stops drinking, they will have a seizure and likely be dead within a week. Opioids are perhaps not as severe, but they're still so incredibly bad. Over time, from repeated opioid use, your brain and central nervous system adapts to the presence of opioids. Immediate opioid cessation can cause significant changes in the brain rapidly as it tries to regulate itself. This can see random changes in mood. For example, norepinephrine will try to restore itself, causing anxiety attacks and restlessness, while serotonin imbalances alongside can cause severe depressive episodes and suicidal risks. Pain sensitivity will also become apparent. As opioids are used for the management of chronic pain, sudden stops can send the body into overdrive, feeling all this pain at once. All these withdrawals will then cause insanely powerful cravings for the user, as if the brain is begging them to return to using methadone again. For no human has ever woken up and decided to become addicted to drugs. It's these withdrawals that make sobriety one of the hardest challenges man can face. Many users have reported methadone's withdrawal symptoms to be excruciating, with some even going as far to claiming it's worse than heroin itself. Couple this with the ever-increasing prescriptions, why would an addict want to detox off their methadone, knowing that tremendous pain awaits? We as humans are biologically predisposed to avoid this pain. It's no surprise that many stay on their scripts for so long, ultimately increasing their dose. But are there any other effects? Methadone also sees its profile contain a huge number of changes to the body. Early research saw big changes to users' hearts. In fact, significant cardiac changes were to occur. QT interval and torsade de pointe would be prolonged, whilst changes in QT dispersion, pathological U waves, and even Takotsubo syndrome, stress cardiomyopathy. Users were also at significant risk for coronary artery disease. If we travel further down in the body, the next organ susceptible to damage is the liver. Many papers found that methadone was in fact a precursor of liver disease in users due to it being metabolized here. However, this one should be taken with a pinch of salt, due to these results mainly occurring in those patients with either hepatitis B or C, something naturally decreasing liver function. Nevertheless, the occasional study has found somewhat of a link between elevated liver enzymes and methadone consumption, so we really need more experimentation to see if this is causation. However, there was also some interesting studies on the brain. Now, these experiments found that when rats were chronically exposed to methadone, induced microgliosis, astrogliosis, and neuroinflammation occurred in the hippocampus. This is the brain region associated with memory, hence the channel name. And in humans, hippocampus inflammation has been found to produce memory dysregulations. Other experiments on rats found that when the hippocampi are inflamed, they lose their sense of space. But again, do remember, these experiments are on rats. There's no way of saying this would be the same result we'd find in a human. What we do have evidence on though is respiratory depression. This is the key component of what causes an overdose. Just because methadone is prescribed does not mean it sees the user safe from an OD. It's actually the opposite. Many people have reported overdosing on methadone, just wanting to stop their pain or violent cravings, again, which isn't their fault. Thankfully, these people survived due to the administration of naloxone saving their lives. So, I've showed you the problems with methadone treatment, but the key question is, are they worse than heroin? It's subjective. Personally, I believe that by being regulated and managed in a clinical setting, methadone has indeed saved many lives, but these problems are still present. So, what can we do instead? Thankfully, there is the option for alternatives to methadone that are proving to be useful in opioid addiction. Buprenorphine is one. This, instead of a liquid, is commonly in tablet form, but works as a partial agonist. It binds to the same receptors as methadone without causing nearly as much of a high. Yes, it's still addictive, and yes, it's an opioid, but the reduced potency makes it suitable for those not consuming many milliliters of methadone, or those ready to begin detoxification. It's also had significantly fewer opioid-related deaths in the past few years. There also exists naltrexone and Buvidal. These are long-lasting injections that block opioids in the brain, working as antagonists. If you take heroin alongside, it'll just be pointless. This can only really be done when people are on low doses of opioids to prevent the nasty withdrawals. Still, these have side effects too, including headaches, nausea, sweating, insomnia, and again, withdrawals, albeit to a lesser degree. So there are the problems with methadone. As you can see, it has its flaws, yet has also proven to be successful for many people in curbing their addiction. Yes, it does have its problems, which are arguably better than the substances it's alleviating. However, one cannot deny that methadone has paved the way for future treatments, and it is hoped that newer, more efficacious ones become available soon. But if there's a take-home message at all today, it's please don't do opioids. It gets better, bro. Thank you so much for watching. I appreciate every single one of you. Be sure to like and subscribe if you enjoyed. It's free and it really helps me out. See you next time.